everyone, thanks for tuning in for another national workshop. Today we're going to be discussing rest, recovery, and overtraining. My name's Amanda Brown and I'm a fitness and sports instructor with PSP at CFB Borden. In today's workshop, we're going to be discussing why rest and recovery is so important, what is overtraining, how to avoid overtraining, and then we're going to be discussing the ideal work to rest ratio so that you can avoid being overtrained. That being said, let's get into it. Why is rest so important? This is when the body actually adapts to the stress of the exercise and where the actual magic happens. This is where the training effect starts to take place. Whether you're sleeping or you're just taking rest, proper rest between exercise sessions. It allows your body to replenish energy stores and repair the damaged tissues. If we continue to exercise without proper rest, the body will be unable to repair and replenish and will continue to break down from the excessive exercise. And that in due time is going to lead to overtraining, which we're going to talk a little bit more about later. But a lot of the time, symptoms of overtraining come from not enough rest. Okay, let's talk about short-term recovery. This is what's occurring in the hours immediately following the exercise session. And that starts with the cool down, meaning that you're doing some light walking or some light stretches. This is going to help bring down your heart rate, which has been scientifically proven is very important in the recovery process and is linked to performance. It's also important that you replenish the energy stores and fluids that you lost during the workout. So this is going to be done with your post-workout nutrition. So you need to make sure that you're drinking enough water to replenish the fluids that you sweat out during your workout, and that you're also having something to eat to replenish the energy that you've lost. Your body is going to work to repair the tissues and remove byproducts during this time. So things like lactic acid and whatnot that were built up during the workout. It's also going to be really important that you're getting quality sleep. 1 or 2 nights of bad sleep during the week isn't going to be extremely detrimental, but it is important that you get quality sleep. Because if you don't get quality sleep every night, this is going to affect things like your hormone levels, it'll affect how your muscle recovery is, it'll affect your overall mood, and these are all things that can lead up to overtraining, which isn't good. So it's important that you also make sure that you're getting quality sleep at night to help you in the recovery process. When we start looking into long-term recovery, we're going to be looking at periodized training programs, things that are going to be lasting a little bit longer, maybe 6 months to a year, could be even longer than that. That's going to involve modifying the volume and the intensity of the exercise, and it's also going to involve modifying the training type and the frequency. It's important that you consult with your local PSP staff if you're getting your personal training program made for you, so that we are able to incorporate the appropriate amount of rest and recovery to help you reach your goals and your style of training. Next, we're going to be talking about overtraining. Generally speaking, athletes train to increase their performance. By increasing the training stimulus or the training load, that's what's going to give you the increase in performance when you have the proper rest and recovery. When you don't have the proper rest and recovery, that's when we start to get into the overtraining syndrome. So right now we're going to be talking about the stages of training-induced fatigue. So first, we're going to be talking about functional overreaching. Then we're going to talk about non-functional overreaching, and then lastly, we'll get into the full-blown overtraining syndrome. Overreaching is typically used by athletes in their training cycle to increase their overall performance. We would typically see this in a 1 or maybe 2 week training camp. So what goes on is we increase the training stimulus. As you can see, that would be done in the blue over here on the graph, and it actually creates a decrease in overall performance from increasing the stimulus so much. But with proper rest to recovery, this could usually be days, but it could be up to 2 to 3 weeks of proper recovery. We then see this super compensation curve, meaning that we have an increase in performance from where we were at the original baseline. The European College of Sports Science put out a position statement defining the stages of training for induced fatigue. So this is the table that I'm going to be quoting at the bottom, because I think it's really great and it makes it easy for you to understand. So here we're talking about functional overreaching. It's also known as short-term overreaching. So it's defined as increased training leading to a temporary performance decrement with improved performance after rest. So that's what we could see by the supercompensation curve here. We see the increased training stimulus causing a temporary decrease in performance, and then we have the proper rest and recovery, and then we move into that supercompensation curve. So the performance decrement, it's going to be days to weeks. Like I said, it could take up to 2 to 3 weeks for the recovery there. But the overall outcome is going to be positive for the functional overreaching. So this can be used to actually enhance performance, but it does have to be used properly. If this intensified training continues, the athlete can actually move into an extreme state of overreaching called non-functional overreaching. So this happens when we have the intensified training, but then we're taking longer than a 3-week period to recover. So it can take weeks to months. But the key here is that with proper rest, after you see the decrease in performance, you will return to your baseline performance with the proper rest. So that's the key here. So that's from having too long of an intensified training period without the proper rest. So if we go through the table here, non-functional overreaching is also known as long-term overreaching. So it's defined as intense training leading to a longer performance decrement, but with full recovery after rest. That's the key point here. It's accompanied by increased psychologic and or neuroendocrinologic symptoms. So that means that we're having some psychological symptoms, so changes in mood, maybe you're not sleeping as well, and then the neuro and the endocrine function is going to be different as well. So if we were to do a blood test, we're going to be seeing some hormonal changes, and the neural connection might not be as good. We might not be able to perform as fast or as well when we're actually doing the athletic performance. So that's what it's talking about here, that we're seeing that decline in the physical training performance there. So the performance decrement is going to last from weeks to months here, but you will come back to the performance baseline. The overall outcome of non-functional overreaching is going to be negative due to the symptoms and the loss of training time. It's going to affect negatively. So if we continue to pursue this intensity of training without proper rest, we're going to get into that overtraining syndrome, which we're going to talk about next. So now we're going to discuss the actual overtraining syndrome. So this is defined as an accumulation of training and or non-training stress resulting in long-term decrement of performance capacity with or without related physiological or psychological signs and symptoms of maladaptation, in which restoration of performance capacity may take several weeks or months. It could even take years. So if we look at the graph here, the big thing that we're seeing is we're not returning back to that baseline performance even after several months of proper rest. So saying greater than 1 month. So if we look at the chart here, we're talking about the term overtraining syndrome. And it is going to be consistent with extreme non-functional overreaching, but with larger performance decrement, going to be greater than 2 months, more severe symptoms, be it physiological, psychological, neurological, immunological, and we're going to talk more about that a little bit later, some of the signs and symptoms, and an additional stressor not explained by another disease. So a lot of the time when people go to the doctor and they are clinically diagnosed with overtraining syndrome, it also presents with an undiagnosable lack or decrease in performance rather. So the performance decrement is going to be months, could be up to years as well. And the outcome, obviously, for this one is going to be negative, just due to the symptoms, and it says, and possible end to athletic career. So that's just because of like the time that you would have to take off to fully recover. And a lot of the time, some people might not even be able to get back to that baseline performance where they were before. So that is the career consequence that this could have. So next, we're going to be talking a little bit about what might trigger overtraining, and then talk about the signs and symptoms so that you can see maybe if you're starting to get towards some of the overtraining area and how that can be avoided. So now we're going to talk about some of the things that can lead into overtraining or that non-functional overreaching. So an increase in training load without proper recovery. So we've talked about that a few times already, making sure that you have proper rest. I'm going to be talking about appropriate work to rest ratios a little bit later on in the workshop. It's definitely going to be beneficial into preventing the non-functional overreaching or the overtraining syndrome. Monotony of training. So that means that you're doing the same thing over and over. Maybe you always run 10 kilometers every single day, or maybe you're training the same body part 4 days a week without proper rest in between. That can definitely lead to overtraining. It's important that you have variety in your training, that you're cross training and doing things that are going to be complementary to your goals. So that's why it's important that you speak with your local PSP staff. They're going to be able to help you do that so that you don't lead into getting overtrained. Sleep disturbances. As I mentioned before, it's going to be really important that you're trying to get a good night's sleep. Sleep hygiene is really important because it does affect your hormones and your immune system if you're not getting good sleep at night. So make sure that you're practicing good sleep hygiene, and that'll definitely help you in the long run. Personal and occupational stress. So family stress, work stress, that can definitely play a role into leading being overtrained. It's important that we don't only manage the physical stressors, but we're also making sure that we're taking care of ourselves mentally and psychologically. So making sure that when you're taking your rest days, that you're taking the time to mentally recuperate as well. Maybe you're practicing meditation, reading a book, getting away from screens, spending more time outside. All of that is going to be beneficial for you. If you've had a previous illness, that can also make you more susceptible to having lower immunity or just different changes in the hormones, so that could make you more susceptible as well. Altitude exposure. So that kind of goes to what we were talking about before when people with the functional overreaching. When people do a training camp or sometimes an altitude camp, the goal is that you overtrain and then you come back and then you have that super compensation or that increase in performance from training at the high altitude when you come back down. But if that's not done properly and the intensity of the stimulus is too high, as we've seen, you're going to get into the non-functional overreaching, or you're going to get into that full-blown overtraining syndrome. Heat-related illness as well, so things like heat stroke and heat exhaustion could also definitely play a role in your ability to recover more quickly or fully recover back to the baseline where you were before. It could take months for you to fully recover. So next we're going to be talking about some of the signs and symptoms so that you're able to recognize if maybe you're leading into overtraining and how to avoid it. How do you know if you're overtraining? As I mentioned before, patients will typically present with an unexplained reason for underperformance. Overtraining syndrome is going to be a clinical diagnosis, and it's going to be done by reviewing a history of behaviors. So what they're going to be looking for is seeing a decrease in performance despite weeks to months of recovery. They're also going to see disturbances in your mood. There's going to be a psychological aspect. And there's also going to be a lack of signs and symptoms or diagnosis of possible causes for underperformance. So kind of ruling out any other diagnoses before they consider overtraining. But here are some of the signs and symptoms. So I've categorized them a little bit. These ones are more common for aerobic activities. So that's activities that require oxygen. So usually our endurance sports, we're talking about longer swims, runners, cycling, even lots of different sports. And then these are more common for the anaerobic activities. So things like weightlifting, sprinting, things that are events that are a little bit shorter. And then I've included a list of other symptoms as well. So under the aerobic symptoms, so for more of the endurance sports, we're going to be seeing fatigue, depression, bradycardia, so that means a decreased heart rate. You'll see a decreased resting heart rate in the mornings over time, as well as a lack of motivation. So we're also seeing kind of those changes in the mood with the depression and lack of motivation there. For the anaerobic activities, we're going to be seeing insomnia, irritability, agitation, tachycardia, that's an increased heart rate, hypertension, that means high blood pressure, as well as restlessness. So that plays into the insomnia and irritability. They're probably not getting very good sleep. Some of the other symptoms you might see are lack of mental concentration, sore, heavy, stiff muscles for extended periods of time, anxiety, and feeling unrefreshed despite a good night's sleep. So even if you're sleeping throughout the night, you wake up in the morning and you don't feel recovered, you're still feeling very, very tired despite being able to sleep throughout the night. So these are all different signs and symptoms to look for you to be aware of maybe if you're starting to get into that non-functional overreaching or even into the overtraining syndrome. So now we've talked about some of the things that can trigger overtraining as well as the signs and symptoms. So let's get into some behaviors we can do to avoid overtraining. So first, eating properly. Proper nutrition is going to play a huge role. Your pre and post workout nutrition is going to be really important. So make sure that you're on top of that and that you're fueling your body properly so that you can replenish the energy stores that you use during your workout. Good sleep hygiene. As we've talked about before, it's really important that you guys are getting a good night's sleep because that's going to help in the recovery process. Deal with non-training stressors. So that's meaning that you're addressing the things that are stressing you at home or at work and you're finding positive outlets for that. So whether you're going for a walk, you're chatting with friends, meditating, doing something relaxing, try and find some positive coping mechanisms that you can use to handle those kinds of stress in your life. Take a rest day at least one day a week. After we go through this list, I'm going to be talking to you guys about some proper work to rest ratios. But when it comes to working out, more is not always more. So make sure you are taking at least one rest day a week. It's going to be really important so that you don't move into overtraining. Stretch and massage. Stretching and working on your flexibility is really important. I usually recommend doing that 5 to 7 days a week. Because it is a passive activity, you aren't going to risk getting into overtraining by doing it every day. It'll actually have a positive benefit for you. So make sure that you guys are taking the time to stretch. Massage can also help really a lot with tight muscles, but also mentally for your relaxation because we want to focus on having a good mental health as well. Cross training. So that's just talking about not doing the same workout every day of the week. Not only is it boring, but it's not an effective way to train. So make sure that you're mixing up your training with weight bearing versus non-weight bearing activities. So if you're weight training one day, maybe the next day you're doing yoga or swimming, something that's low impact, or maybe even cycling. So you're alternating between high impact and low impact activities is going to help you in the long run as well. And my major point here is always listen to your body. If something isn't feeling right or something's hurting, make sure that you're addressing that right away. Okay, here are some ideal work to rest ratios for some different kinds of exercises so that you can avoid overtraining. So if you're doing vigorous activity or high intensity activity, HIIT training, that's going to be stuff that is 60 to 89% of your maximal capacity. It's recommended that you're doing that no more than 3 to 5 days a week, so minimum 2 days of rest in there. If you're doing light to moderate activity, which is anything up to 60% of your capacity, that's going to be safe to do 5 to 7 days a week. I only say the 7 days if that's light. So that's considering like if you're going for a walk or something like that, or a light swim, or just an easy bike ride. Of course, we want to encourage getting your daily physical activity in. So going out for a walk every day of the week isn't going to be harmful to you. If you're doing that really high intensity training every day of the week, that you're going to start to see those negative implications. If you're weight training, you want to make sure that you're waiting 48 to 72 hours between training the same muscle group again. So if I trained upper body on Monday, I'm going to be waiting at least till Wednesday to do those upper body muscles again, just so we don't get any kinds of injuries or move into that overtraining area. So make sure that you're giving yourself the proper amount of rest. If you are lifting really heavy, like 1 rep maxes or 3 rep maxes, even 5s, you might need up to that 72 hours of rest before you're ready for your next session. So that just goes into like what we were talking about previously, about listening to your body and doing what's best for you, because everybody is different. So if you think you're overtraining, here are some options that you can do. The first thing I always recommend is that you consult with your physician. They're going to be the ones who could clinically diagnose you with overtraining and are going to know you best to help you move forward in the future. Next thing I would recommend is to start cross training. This will help if you've overworked certain muscle groups, and it'll also help with mental fatigue and get away from the monotony of the training that you're already doing. So maybe trying some non-weight bearing activities and just mixing up your training style. Get a massage and practice relaxation. So like we mentioned before, getting a massage will help you relax your muscles and your mind as well, but practicing things like meditation or yoga, going outside for a walk, spending time in nature, all of those things are going to be really great for rest and relaxation. Make sure that you're staying hydrated. As we've mentioned before, that's going to be really important to replenish the fluids after your workout, which is also going to aid in the recovery process. Last I have written here is rest and recover. So depending on your situation, this might mean taking time away from training completely for a couple of weeks or even a couple of months until you're able to recover properly. Every person is going to be different. So what should your rest day look like? It's going to be different for everybody. It doesn't mean that you have to be a couch potato and sit around and do nothing all day. I do recommend that you take time to go outside, go for a walk. Maybe you're trying a lighter activity, you're trying yoga, you're trying meditation, you're doing something that relaxes you for the day. Maybe you're reading a book, you're watching a movie, you're spending time with friends and family. It just means that you're taking that time to step away from your training and that high intensity exercise for your body to have that time to properly rest and recover, so that we prevent injuries over time, as well as we prevent becoming overtrained. So that is everything from me and all I have for you for this workshop. Thank you guys so much for taking the time to watch. I hope that you learned something. Stay tuned for more national workshops. Take care. See you guys later.